First aid of fracture. Types of fracture. 1. Transverse fracture. 2. Linear fracture. 3. Oblique non-displaced fracture. 4. Oblique displaced fracture. 5. Spinal fracture. 6. Greenstick fracture. 7. Comminuted fracture. Another types of fracture: open and closed fracture. Signs and symptoms. 1. Severe pain. 2. Look for an open wound that may indicate an underlying fracture. 3. Difficulty in movement. 4. Swelling. 5. Bruising, bleeding. 6. Deformity. 7. Abnormal twist of limb. 8. Tenderness on applying pressure. Take these actions immediately while waiting for medical help. First aid of fracture. 1. Stop any bleeding. 2. Immobilize injured area. Don't try to realign bone and apply a splint to area. 3. Apply ice packs to limit swelling and help relieve pain until emergency personnel arrive. 4. Treat for shock. First aid of sprains and strains. 1. Follow DRABC, danger response, airway, breathing, circulation. 2. Follow RICE management. I, rest. I, ice. C, compression. E, elevation. 3. Seek medical aid. First aid of burn. Definition: direct tissue injury caused by thermal, electric, chemical and smoke inhaled (TECS). Classification of burn. 1. Partial burn. A. First-degree superficial burns. Affect epidermis. Painful redness, erythema, and blanching upon pressure with no fluid-filled vesicles. B. Second-degree deep burns. Affects epidermis and dermis. Very painful. Erythema and fluid-filled vesicles, blisters. 2. Full-thickness burns. A. Third and fourth degrees burn. Affects all layers of skin, muscles and bones. Less painful. Dry, thick, leathery wound surface known as ESCHAR, devitalized or necrotic tissue. Assessment. Rules of nines. 1. Head and neck equals 9%. 2. Arm chest equals 18%. 3. Post chest equals 18%. 4. Arm 9 plus 9 equals 18%. 5. Leg 18 plus 18 equals 36%. 6. Genitalia, perineum equals 1%. First aid of pain. For minor burns including first-degree burns and second-degree burns limited to an area no larger than 3 inches (7.6 centimeters) in diameter, take the following actions. 1. Cool burn. Undercool. Don't put ice, running water for 10 or 15 minutes or until pain subsides. 2. Cover burn with a sterile gauze bandage. 3. Don't use ice. Putting ice directly on a burn can cause a person's body to become too cold and cause further damage to wound. 4. Don't apply egg whites, butter or ointments to burn. This leads to infection. 5. Don't break blisters. For major burns, call 123 or emergency medical help until an emergency unit arrives. Follow these steps. 1. Don't remove burned clothing. 2. Don't immerse large severe burns in cold water. 3. Check ABC. 4. Elevate burned body part or parts to raise above heart level when possible. 5. Cover area of burn. Use cool, moist, sterile bandage. 6. Get a tetanus shot.